let's answer some of your questions tonight. I'm so excited to see you so excited about it because we are happy and we know it's going to be great.
Real quick.
Yep, Joe has something to say. Joe.
Alice was asking, she started a cloth diaper. I don't know if you can see her comment.
Yes, I did.
And she's asking like what kind of things they could post about.
Oh, okay. So you're asking, okay, so Dallas says, I started cloth diapering as you suggested. We've been doing it ever since. Yay. And we are so happy. Best experience ever. Hope we can post about cloth diapering too in the new. You can post about anything in the new group. Okay. It's not just a breastfeeding group. And this is something that you guys, I've been trying to tell you for a long time that, you know, my experience and my teaching really goes way beyond just breastfeeding and pumping. And I know that's something that we talk about all the time because that's what you guys ask me questions about. And I love the topic, so I will always talk about it. But we can talk about anything. We can talk about birth, cloth diapering, parenting, baby wearing, potty training, solids, whatever you want to talk about, we're going to talk about there. So yes, all topics are open. And that's it, you know, guys. And I'm expecting you guys to all discuss with each other and let me be a part of that. So I think it's going to be fantastic. Good question, Dallas. Good question. Okay, let's answer some of your questions before I fade because tonight is, like I said, not feeling so good. And before my throat starts to hurt and then I start coughing and have to turn this off quickly and run. Okay, so first question, let's see here. Okay, here's one. Karina asked the question. She said she has to get an MRA, but I think she meant MRI with contrast done. She had a brain aneurysm 3 years ago. Oh my goodness. Okay. Will the dye affect or be absorbed into my breast milk? My 4-month-old is exclusively breastfeeding. Okay, great question, Karina. And, you know, we get these questions all the time about MRIs, about medications, you know, do you have to pump and dump? What's going on? And here's the answer to that. The amount of contrast that's going to be going into your breast milk is in such small doses that no, you don't have to worry about breastfeeding after the MRI, okay? In fact, of all the contrast that you're going to get, and I'm assuming it's going to be IV contrast, not oral, because it doesn't sound like you're doing an abdominal scan. But the contrast that's going into your body, it's only about 0.04%. And I looked this up for you specifically because I wanted to be really specific about this. 0.04% of the contrast that you take is actually going into the milk. Okay, that's how little is actually going into the milk. And of that 0.04% that actually makes it into the milk, only 0.8% of that actually gets absorbed by the baby. So we're talking such insignificant amounts, not even worth thinking about. Not even worth thinking about. Okay, so totally fine. No reason to pump and dump. Totally safe. You know, these are scans that sometimes they do on babies too. So I would say go ahead, have your scan. Really important with your history for sure, and don't worry about it. Okay, so yeah, I hope all goes well for you. All right, these are great questions because medications is always a big one. And as I was saying before, like when we start doing our topic-driven live streams that we're going to start, these are some of the topics that we're going to cover, like a whole episode on medication, so you really understand it really, really well. All right. Okay. Let's see. Renee. I told you I'd answer your question, Renee. I know you really wanted to know. I have one breast producing a lot less than the other. Is there anything I can do to increase the one side? I'm starting to notice my breasts are becoming different sizes. Okay. So first of all, yes, you can start to make more on one side than the other because if one side's being favored by the baby and you're actually expressing more from one side, that breast will start to make more milk. But that's typically not the reason why it happens. Typically and commonly, women are not symmetrical. Your breasts are not symmetrical, and you'll have one side that's more of a producer and one side that's less of a producer. So one side will just make more milk than the other. That has a lot to do with your breast capacity. That breast just has more ability to make milk, can hold more milk. And so can you do anything about it? sometimes pumping or using that breast more will actually produce more milk, but many times there's nothing you can do about it. It's just not going to make as much as your producing side. Okay, so there's one that's going to be the more dominant side. That's what we like to say, more dominant. So there's nothing wrong with that. And you might notice that your breasts are different sizes. And for some people it can be really significant, like a really big difference in size. But as far as, is it a problem? It's really not a problem unless for some reason there's a reason that you're not making milk or that you're not expressing the one side and that one side's drying up. Your breasts work independently of each other. And so if you don't nurse a lot or nurse enough on one side, you can decrease your milk supply. So say you keep going back to the same side, the same side, the same side. Over time, one side can dry up while the other continues to produce. And for some people, this actually is advantageous when they have maybe one breast that keeps getting mastitis, you keep getting breast infections. I've had moms where we just can't stop the infections on one side, and then they actually choose to let one side dry up and they exclusively breastfeed on the other. And I've told you guys this before. I did this with my first baby. With my first baby, I personally had this happen. She just completely rejected the left side. I always made twice as much milk on my right than on my left. It was just more of the producing side. And by the time she was 4 months old, little stinker just decided she didn't want the left side, and it dried up. So, because I didn't pump it. So, but it was okay. At 4 months old, I just completely started nursing on the right side and did that the whole rest of the time I was breastfeeding her, and always made enough milk from one side. So, I've heard, and I know other people giving you advice about, you need to pump it, and you can try that, but I really don't think that's the reason. Okay. That's amazing. Yes, it is amazing. Our bodies are amazing. And the more that you express from the breast and independently from each one, that's how much you're going to make. You'll keep making more. Okay. So there's my answer to you. You don't need to. That's why, moms can breastfeed twins so successfully, because you can make enough from one side to completely feed your baby. Yoshi's asking, wow, how long did you pump on one side? I didn't pump the other side. That's what I'm saying. Like, I never pumped the left side. She just ate on the right and then refused to drink on the left. And then over time, what winds up happening is, as the milk starts to dry up in the breast, it goes through a process of involution. And that involution means that's the drying up of the breast milk on that one side or both sides when you're weaning completely. And as that happens, the sodium or the salt content of your milk starts to increase. And so the breast milk starts to taste salty. I didn't realize this at the time, 15 years ago. But when she was nursing, didn't understand why she didn't want to drink the left side anymore. And then I decided to taste it to see is there something wrong with it. And one side was sweet and one side was salty. And I understood why she didn't want the left side anymore. And I guess I could have pumped it, but at that point I was too busy. I just decided, I'll just nurse her from the right side. So I went on for another year from there and just completely nursed her on the right side. So there you go.
Two things.
Something to say. Yes, Joe. Oh, okay. Intro slow tonight. There we go. Good. Here
Her personality didn't change.
It didn't.
So for any older moms, you could probably agree or share your experience that their attitude or behavior when they're a baby kind of just amplifies when they get older, and she still likes to have it her way, and you can't really convince her otherwise.
You say black, she says white. I said right, I said left, she said right. There you go. That rhymed. That was pretty good.
I'm impressed, dude. The second thing is, let's start a new practice. Every time Shari answers a question and give some love back to the mama who asked her a question, then let's give Shari some love and the mama some love for a great exchange.
Excellent.
Cool.
More love? We will always take more love.
All
Thank
right,
you.
cool.
Good suggestion. Do you love him? Isn't he the best? He's a good one. He's a good one. Lucky. I know.
This will help keep you pumped up.
Thank you, Joe. Thank you, Joe. Perfect. Yay. Yeah, she says black. I say white. All right. Anyway, let's keep going here. Lots more questions. Look at all the love now. Whoa, look at that. Yay. Okay, that makes my night. That makes my night. Thank you, sweetheart. Okay. Let's go on to, all right. So Yoshi, I know you're here, and I know I just saw you ask a question, and you did post a question. I'm going to answer it right now. Will switching from pumping to breastfeeding lower my milk supply? I exclusively pump plus or minus 60 ounces a day, and I'm nervous my supply will drop if I start exclusively breastfeeding. Another question, can I keep the twins on a schedule if I switch from exclusively pumping to breastfeeding? Okay, great. So first of all, 60 ounces for twins, appropriate, okay? So I was gonna say, until I got to the second part of your question, 60 ounces is a lot of milk. But for twins, perfect, okay? Will you make less if you breastfeed instead of pump? Now I'm going to start coughing. Hold on a second. I have a tickle in my throat because I have a cough. And it gets violent if I start. Okay. Yes, it's possible that your milk supply can drop off because if your babies are actually not drinking that much compared to what you're giving them in the bottle, which sometimes they do drink more from the bottle than what they drink from the breast, because you could just keep feeding them more, then your milk supply will regulate to what the babies are drinking. On the other hand, the babies can get out more than the pump. So it all comes down to what they need. That's a good thing, okay? Because if you need 60 ounces, they'll drink 60 ounces, and then there will be no difference to your breast. Your breast will just continue to not know how that milk is coming out. It's just coming out, and they'll continue to make what you need. If you don't need 60 ounces, you won't know anyway. You'll just know that you have 2 satisfied babies. So the answer here is, I definitely would try to switch back to breastfeeding if possible. If they're nursing, if they'll latch like that, it's so much easier. I think that, pumping is, of course, a wonderful thing if you can't latch the babies, or if you choose not to at least give the babies breast milk. But at least, especially with twins, it's so much more work because you have to pump and then feed the babies, and then you've got all the washing and the pump supplies and all those other things. So if you can go to breastfeeding, that would be great. As far as the schedule, switching from exclusively pumping to breastfeeding, typically babies, they're not as easy to schedule on the breast, but they'll still stay on a pretty good schedule if the babies are already eating every 3 or 4 hours. I don't know how old your babies are, 2 hours, 3 hours. They'll probably stick to that same schedule if you're breastfeeding or if you're bottle feeding with pump milk. So you can keep them on a schedule. It all depends on how young they are. If they're really small, sometimes they will need to eat more frequently, and it's hard to schedule them because the timing of day, the day of the week, each week it changes, and so it's hard to sometimes schedule it. And I know that's hard with twins, but overall, it should take you less time to breastfeed than to pump and feed. So I would try it. If I were you, I would try it. Yes, hello, you're late. I'm glad you're here. It's okay. We'll take you late. Better than never. Okay, so yeah, great job though, Yoshi. 60 ounces, perfect. Now, she's describing 60 ounces for 2 babies, okay? Really want to emphasize that because I know some of you are going, 60 ounces? I don't make 60 ounces. You don't need to make 60 ounces. If you have 1 baby, you don't need to make 60 ounces. 1 baby will drink somewhere around 24 to 28 ounces in a 24-hour period, okay? 1 baby. Even up to 30 ounces. So Yoshi's making 60 ounces. That's 30 ounces per baby. That's about right, okay? You guys are doing the same thing. It's just that she needs double milk. And see, her body's producing it because she had double babies. Perfect. Excellent question. Okay, let's move on here. Look at all these The babies are 6 weeks. Okay, so Yoshi's answering my question. The babes are 6 weeks and eat every 3 hours on the dot. I will try it. Thank you. Okay, great. Yeah, that's perfect. 3 hours every 6 weeks. You've got great milk, so I'm sure they'll continue to do the same thing. As long as you're efficient with your feedings. A lot of that has to do with positioning and latch. You can have all the milk there, but the delivery of that milk will really be dependent upon how well you're latching the baby, and how efficient the baby is at getting the milk out. If you don't have good positioning, the baby won't be attached to the breast as well, and the milk won't come out as easily. Okay, so you want to be very comfortable. You want to be supported. You want to be holding the babies in a way where the babies are coming to the breast and close to the breast. Their bodies are completely facing you. Their chin is leading and buried into the breast tissue. Their heads are tilted. We've talked about this before. Oh, I got my little baby here. Okay, and so when the baby comes to the breast, they're not coming straight to the breast or with their neck down. They're actually coming with their head up, so the breast is here. And that kind of angle to the breast instead of that, okay, helps them to breathe, as well as lead with their tongue and their lower jaw and attach to the breast deeply, which will help to drain all the sinuses and the milk ducts there and have the milk flow efficiently. Also, when the milk does come out, they can swallow, okay? It makes it easy to go down. So lots of good reasons why you want to be positioning the baby properly at the breast, okay? If you guys have not seen my Simply Breastfeeding class, now's the time, okay? There's a whole chapter on latch and position, not only with she's actually from class. She's been around for a long time, my little baby here. Jamie always makes fun of her hair, but I like her hair, okay? It's curly. She was in the class, and I will show you latch and position in the class. I also have a live mom that I worked with in the class, so you can see what that looks like on a live mom with mom breastfeeding. So, right, as we said earlier, if you take the class, you will get into the private group too. So even more reason. Hi, Jessica. Okay, so let's see. Any other questions? Lots more. Let's keep going here. Okay, more twins. Kristen, and while we're talking about twins, let's keep moving on to twins. I'm exclusively breastfeeding 2-month-old twins. Good job. Okay, over the past couple weeks, I just have to say something before I keep going. I have so many clients and moms who are exclusively breastfeeding twins. And so if you right now are watching this video and you are pregnant, expecting twins, if you know someone who is and they are concerned, worried that they won't be able to breastfeed, please, please, please send them over to me. We have so much success. I've had dozens and dozens and dozens of moms with twins exclusively breastfeeding to a year and beyond. And so it is so doable. I just want to say that because I know that you're getting like a ton of other information and stuff that's scaring you, telling you that you're not going to be able to do this. And that is not true. Okay. So Kristen, good job. Exclusively breastfeeding 2-month-old twins. And over the past couple weeks, when either of them are done latching on the left breast, the nipple turns white and hurts. I alternate breasts, so it's occurring with both of them. I'm assuming you mean with both babies. Yeah, the left breast, but with both babies. Okay, the past couple of days, the pain has been happening even when they aren't feeding. It only lasts for 10 minutes usually. Is there any way to stop this? Well, when you're describing that the nipple is turning, white, okay? Is that what you see? It turns white and hurts. The pain and the whiteness are both signs of something called Raynaud's syndrome, which is a vascular, like a vasoconstriction at the nipple. That means that the blood flow to the nipple is being clamped off, and that's the whiteness that you can see. It can cause a lot of pain and a white blanching of the nipple. Typically you see it in both breasts, so I'm surprised that you're describing it in one, and that could mean that there's something else going on. But that white pain, that white nipple, and the pain when they come off, you said done latching, so it's not like when they first latch on or when they first start feeding, but when they come off the breast and it's with both babies on the same side, I would say it's probably vascular. And one of the things that you can do about that is try taking like a hot compress, not necessarily moist, but just a warm, something warm, like a warm heating pad. And when the baby comes off the nipple, take that heat and apply it to the nipple immediately and see if the heat helps with the pain and with the blanching, because if it's that you are getting that vasoconstriction, the heat can sometimes open that up and stop the pain. If that works, then it's probably from that. If it's only happening on one side, which is actually making me think that it might be possibly your positioning. Hold on, I need another sip. Now I'm drinking tea. Okay, good for my throat. If you are getting it on one side, it could be that even though it's both babies, that your positioning in some way is not right. Okay, that you somehow are holding the babies in an odd position. You may be more dominant with your right hand or your left hand. So it could be that's what's happening as well. And the last thing too is it could be that that you're saying that it's also happening even if they aren't feeding. Yeah, you know, plug ducts, blebs, little milk that's stuck in the nipple, that could keep the nipple looking white too. Yeah, so there's a lot of different reasons here, and it's hard to tell from what you're describing, but the Raynaud's, the vasoconstriction, that really causes that white blanching and the pain. So I would try that heat first. Let's see what that is. What am I drinking? Tea with honey. So what am I? Joe made me the tea. I don't even know what I'm drinking. What am I drinking? So it's yogi tea. It's honey lavender yogi tea. Okay, which is organic herbal tea, and it's honey lavender. So yes, thank you, Laura. It is honey. Drinking tea with honey, and it tastes really good, and my throat is really sore. And you like my mugs? Aren't these cute? These are so cute. They match my dishes. I got them a while ago. Bed Bath & Beyond. They're like the perfect size. Okay. All right. So let's see here. Kelly asked the question. Kelly. I try to nurse as much as I can, usually in the morning and evening. Sometimes I feel like I'm not producing enough for my baby to feel full. Is there anything I can do to increase it? How do you know when your milk supply dries up? Okay. First of all, I want to know why you don't feel like your baby is full, okay? Because this whole idea that the baby is going to come off the breast and not be crying, that's not the only way to tell that your baby is full. Some babies, they just want to suck more. And so you take them off the breast and then they start to cry. You put them back to the breast, they start to latch again. They're kind of pacifying suck. They're not really swallowing. They're not really drinking. They go back to sleep. They're nice and cozy and comfortable laying next to you. And then you go to take them off, they cry. So this idea that that you're not producing enough for your baby to feel full may not be real anyway. It may be more of a perceived issue. The main thing I'd be looking at is the baby's wet diapers, okay? Is the baby wetting 6 to 8 wet diapers in a 24-hour period? That means the baby's hydrated. That's going to be a way better indication that your baby's getting enough milk. Poopy diapers, with yellow, seedy stool, okay, that's going to tell you the baby's getting good, rich hind milk out of the breast too. Sometimes depending on the time of day, your milk supply, and we've talked about this before, your milk supply will be greater in the morning, so you'll have a fuller breast in the morning, and then in the evening the breast can be much less full. The difference is though that milk in the evening has a higher fat content, so that milk's very important. Okay, they're getting lots of calories and lots of fat. The less full the breast is, the higher the fat content of the milk. So it's really hard to determine that based on just the volume of milk. And so Is there anything you could do to increase it? If you need to increase it, the number one thing that I would tell you to do, the number one thing is nurse more frequently, okay? More frequent nursing is what's going to increase supply the most. You can drink all the teas in the world and take all the supplements in the world and eat all the cookies and the oatmeal and all those other things, but if you're not nursing frequently, nothing's going to happen. So if you're nursing a lot, then yes, there are other things you can do, like drinking the Milk-Made tea from Earth Mama Angel Baby, or taking some extra fenugreek. There are supplements that you can take to increase supply. I just hate telling you to do that without knowing whether there's a real issue with milk supply or a perceived issue with milk supply. And I'm not sure from reading what you're saying here, your baby doesn't feel full. I don't know what that means. So I'm not sure that you need to, okay? We need hearts. We need hearts, right? Wasn't that Joe's rule? That was Joe's rule, okay? So hearts for Kelly, hearts for Kristen, hearts for Yoshi. We answered a bunch of questions there. Somebody asked me a question. Kayla asked about, please discuss tongue ties. I saw it. See, I can talk and read at the same time. Oh, but wait a minute. I hit something. Hold on. What did I do? Okay. Oh, God. Okay. All right. Lots of hearts. Lots of hearts. Okay. Awesome. Thank you. Excellent. Okay. So Kayla's asking, can I please talk about tongue ties? Okay. So tongue tie is when the baby has what they call a tight frenulum. The frenulum is that tissue, the elastic tissue that attaches the tongue to the lower floor of the mouth, okay? And if a baby has a tight frenulum, then what happens is the baby may not be able to extend the tongue or lift the tongue the way they need to in order to latch to the breast properly. How do you know if your baby has a tie? Okay, so one way to know is to look and to see, is there a piece of tissue that's coming down that is holding the baby's tongue down, okay? That's the easy way. Sometimes it's very, very obvious where you can look at it and say, yeah, there's something really tight there. The baby can't stick their tongue out beyond their gum line. The baby can't lift their tongue to the roof of their mouth, and I can see the tight frenulum. There's an obvious answer for you. Sometimes it's what's called a posterior tongue tie, where you can't see anything, but the tongue still cannot be lifted up, and it cannot create the same seal to the breast. The tongue is a very important structure when it comes to latching and positioning and holding the breast in the mouth. And so very often what will happen is if there is a tight frenulum, if there's a tongue tie, okay, the baby will have a difficult time latching, and also you may have a lot of pain when latching too. Oh, I love so Anita's offering here, Dr. Gahari in Portland, Oregon. Excellent. So many great videos. I saw him last year speak, and he is like the expert on tongue ties. Okay. So yeah, excellent. Great advice there, Anita. Thank you. Yeah. So go check out his videos. And she's describing her son had a posterior tie that wasn't obvious, but he couldn't nurse, plus he had a high palate. So, all the structures of the mouth, the palate, which is the roof of the mouth, the tongue, all these structures in the mouth will impact how the baby latches and the pain that you'll feel, the way that they create a seal to the breast. And all those things are going to impact whether the baby can drain milk from the breast. And they're important because time is of the essence. If the baby is not latching well, if the baby's not draining the breast well from the beginning, what's going to happen? You're going to stop making a lot of milk. So you want to make sure that the baby, if you have any issues like that at all, if you're suspecting anything, that you get evaluated by somebody who knows what they're talking about, okay? You guys are giving each other advice. Hello. This is the whole reason that we're doing the private group. See how resourceful you all are. See how much great information you have to share with each other. This is perfect. This is exactly what I was talking about. Exactly. Perfect. I love you all. I love it. It's a hard question. Good question. All right. Excellent. He has a great video on how to show how to find a tricky posterior tie. He's great, Anita. Great resource. I love him too. I thought he was so interesting. I loved listening to him speak. Just so much great information. Yes, definitely go over and check him out. Excellent. Yeah, look at all these resources on every coast. You're talking about Oregon. You're talking about New York. You guys are amazing. That's what we need. That's what we need more of. Okay, good. So now let's move on to the next question. Oh my gosh. Okay, Lenka, here, I'm just going to tell you right now, Lenka, your question is super long. I am sorry I'm not going to answer it right this minute, okay? I know that you need some help right now, and what I want you to do is right away, because I know you have watched all of my classes, Lenka, I want you to go and join the private group, and I am going to help you out over there, okay? Because this is a very long question, and this is something for our private group, all right? So go over there, and you may even need a consultation. By the way, you guys, I mean, some of you are asking some really important questions. You have very young babies, 2-week-old, 3-week-old babies, and you're having issues. These live streams are not intended, and nor is the private group. It is not intended to replace your doctor, your midwife, your lactation consultant, okay? None of that is intended for medical advice. I can't do that with you, okay? You need to be working one-on-one. Now, if you want to work with me, I can do that. If you live in the area, you can reach out to me. I do private consultations, but if you don't live in the area, I also do telephone and Skype consultations. I will need to work with you directly. I do charge for that, obviously, right? That's my job. But some of you really do need very personalized advice. And so if I tell you that, it's because I care about you and I want to make sure that you're nursing properly. And there's some things that I cannot do just answering to, like, you know, the whole planet here on Facebook Live. All right. It's just inappropriate. And it would not be fair to you and your baby. Okay. So I will try to do my best. Some of it will be answered in our private group. Somebody just asked, Kate just asked, what's the private group? You missed the beginning of the live stream here, but we are beginning our private group starting tonight. It's the group that we've been talking about for a long time. It is for my students only. Okay, that means anybody who watched a class, took a class, live class, online class, won a class, bought the pump, got the class with the pump. You just have to go over to the link that Joe pinned at the bottom here so nicely for everybody. Hold on, coughing again. And click on that after the live stream. And if you did take a class with me, you can enter your information and you'll be in the private group with us, okay? I'll be doing some live streams over there. If you've never taken a class, you want to get in, just get a class. There you go. And then you get in. All right, so let's move on. More questions. Oh my goodness, I got paper everywhere. I'm like, look at this. You guys are crazy. Okay. All right. Michelle. My baby is 5 months old and I feel like he doesn't eat enough during the day. This has been going on for a few months. He usually doesn't nurse for very long. Each evening I give him a bottle of 4 to 5 ounces of pump milk and he sucks it down. We still use the newborn nipple. Then I nurse to top him off before bed. If I don't give him a bottle, he usually is awake within 3 hours. I would like to stop this cycle and get him to eat more consistently during the day. Any ideas? I didn't turn off I didn't airplane mode, and so somebody just texted me, and I'm afraid I'm going to lose it. Okay. All right, so I'm still good. Anita's asking. I'm sorry, I don't mean to keep skipping around here. Anita's asking where are the class? There are classes. I need to find those. Okay, so you want to post the classes, the link
Well, she get to it from the.
Oh yeah, if you click on the link right here that Joe pinned at the bottom here that says My Baby Experts Community, there's a link to the classes page so you can get a class. And if you go to the classes page, there's a link to the community. So we took care of you in both ways, okay? So if you want to check out the classes.
You definitely want to watch the class first, otherwise you're going to ask a lot of questions.
Oh my goodness. So I had a mom here with her baby, it was a 6-day-old baby this week, doing consultation here, and her husband. And, you know, they had been watching some of my videos online and reached out to me, and they came over to do a consultation with me. And I was like, you have to watch the class before you even come over, because we would have spent the entire time talking about the stuff that I'm teaching that in the class. So they're saying it won't click. Okay, it won't let you click. Oh, you might have to copy and paste it. It might not be a hyperlink. Oh, Joe said try it now. Maybe unpin that one if it won't click. Okay. So, yeah, you're going to ask me all these questions that you're going to go, oh, it's right there in chapter 7. Oh, it's right there in chapter 3. Yeah, it's all there. Okay.
They're on their cell phones.
Oh, you're on your cell phones. Okay, forget it. You got to wait till after. Wait till after. I'm talking anyway. Don't leave. Don't leave, okay? All right. All right. So, Michelle, sorry. Got a little sidetracked there. First of all, that's a lot of milk. That's a lot of milk. So, you want the baby to, he's not eating enough during the day. 5 months old, they can start to become a little bit distracted, but also remember that what I said before, that usually during the day, like in the morning and earlier in the day, the milk supply, your milk supply or the quantity of milk is just greater. So if there's a lot of milk and your breast capacity is large, then the feedings may be more stretched out. It may seem like the baby's not nursing a lot, but the baby may be getting a lot of milk during that feeding, and the baby becomes more and more efficient as time goes on. So the feedings get shorter and shorter. Baby may only be nursing for 10 minutes and getting a ton of milk because you're making a lot in those morning and early in the day hours. So when you say the baby doesn't eat enough during the day, it may not be that. It may just be that the baby's getting a lot per feeding and then going a longer stretch, okay? Or the baby may be eating a lot but not having to eat that long, and your milk is just letting down quickly and there's a lot there. In the evening, you're saying you give him a bottle, 4 to 5 ounces of pumped milk, and then you still nurse after that. If you don't, he usually wakes within 3 hours. 3 hours is kind of normal, okay? So the baby may not be ready to sleep through the night yet, and that may be what's happening. Also, remember, again, like I said, that evening milk is very high in fat because you are making less in the evening. So I think that the main thing to do here is to try to stop scheduling the baby. Try to not think about, like, is he eating enough? Is he... You know, look at more. Does your breast feel full, and then is it feeling empty after the feeding, even if it's been a short feeding? Is the baby getting lots of wet diapers? You know, trying to change their schedule is not very easy to do. Okay, and you could try feeding him more frequently during the day, but it may not work for you because, like I said, he may be getting all that he needs during the day and you're just not aware of it. But it's worth a try. If you feel like you want to try feeding a little more frequently, you can try doing that. It may be that he'll get more of what he needs during the day, and then maybe he will go longer stretches at night. Truth is that you want to stop the cycle and get him to eat more consistently during the day. It may be possible, and it may be that he's already eating consistently. So there's my answer to that. Yeah. Katrina, so let's get some hearts. Hearts for that. Hearts for Michelle. Very good, Michelle. Okay. Val saying, my son would literally nurse for 3 minutes per feeding, but always high for weight percent. Yeah. 3 minutes per feeding. That's because you were probably making ice cream. Okay, Val? You very high fat content, very efficient baby. Excellent, excellent. The length of the feeding really doesn't tell you anything about the amount of milk that's being transferred. And that's why it drives me nuts. Like when you're in, you know, you talk to like nurses in the hospital or your pediatrician saying, well, how long are they nursing on each side? Make sure you're doing 20 minutes on each side. What the heck is that even telling you, 20 minutes on each side? Does that tell you how much the baby's actually eating? No, it's not telling you anything other than the baby spent 20 minutes on that side. It's not telling you how much milk they actually took in. And so I don't really like timing those feedings because, like I said, some feedings may go longer. Some feedings will be shorter. Some times of day you'll have more milk and the letdown will be heavier and the feedings will be faster. Some babies are more efficient and you're only feeding for 3 minutes like Val just said. And yet they're getting all the milk that they need, okay? How much? Yeah, you hate when they ask that. How much do you think? What is the point? I mean, like, really, what is the point? 20 minutes on, you know what it is? I'll tell you what it is. Because I used to be a labor and delivery nurse. I was a nurse for a long time. I know what they're doing. They need to write something down. Like, that's the whole thing. It's all about the chart, right? They need to write down something. They have to quantify it in some way. And breastfeeding is just not quantifiable like that. You know, breastfeeding is, you're not meant to know how much is going in. If you were meant to know how much milk your baby was getting, your breast would have this little gauge on it so that you would know, because it's very, very important for you to know exactly how much your baby is eating. But that's not there, right? Think about it. It's not there. There's no gauge because you don't need to know. You don't need to know how much your baby is getting. What we're measuring, what we're looking for is how much is coming out. Yes, I know. It's right? It's so, it makes sense. It makes sense. There's no gauge. There's no little dial telling you, okay, full and empty, like a gas tank, right? Full and empty. Drives me nuts, okay? So yeah, you like that? Yeah. They don't like it when I say it, but I like it. All right.
Like, you know, that expression?
Yeah, what expression? Let's hear from Joe.
When they want to put somebody in the box, it's like they want to put it in a bottle.
Yeah. There you go. Thank you, Joe. Thank you, Joe. Okay. Yeah.
They get their checklist.
There you go. There you go.
It's got to fit.
They want to fit it in a box. That's right. Well, it's true. And actually what he's saying is very, very true.
You say it better than me. That's why you're on the
It's actually very true. They want to, you know, bottle feeding is an ounces thing, okay? There are little measurements on the bottle. Yes, we can see it. Yes, when you pump it or when you're feeding formula, it is measurable. And somehow that gives people confidence that there's enough. But the truth is, how much is your baby supposed to eat? It really, when we're talking about breast milk, how much are they supposed to eat is dependent on what time of day it is. The fat content of your milk and the calorie content of your milk is different than my milk or her milk. Everybody's different. So the amount that they need, we don't know what exactly do they need compared to another baby or what time of day. So it may be that in the morning, the baby needs more milk. There's more water in that milk. It's less fatty. It's less calories. And then later in the day, the milk is less fatty, more fatty and more calories. And so it's all different. Thank you. You like my nails? My nails. I went to that gala last week, that first candle. It was so wonderful. Let me just tell you about that for a minute. You saw Joe and I all dressed up and in the city, and we went to the first candle fundraising gala. It's the annual gala that they hold, and they raised they raised $200,000 that night for education, SIDS prevention, and stillbirth, and just amazing people doing such amazing work with just helping, you know, with the mission of helping all babies reach their first birthday, and that's why it's called First Candle. And I just love it. I'm going to be involved in it, and I got to speak just a few sentences, but I got to speak on behalf of nurses, which made me so proud to be able to get up and just say something as nurses, as role models. And so, yeah, you hear of that name often, First Candle. They're awesome. They're awesome. They're all about education to keep babies safe and safe sleep. And they also do a lot of work with grieving parents who have lost babies to stillbirth or SIDS. So just a fantastic organization. It was so cool to watch people, you know, they did, it was the first time I was ever at an auction, at like a fundraising thing where you lift up your thing and you donate money and people were buying things, and they had auctioneers, and I was talking to the auctioneer after and asking how they learned to speak that way, you know, when they talk really fast. She was awesome. They had a woman and a man, and we were talking to her, and it was so cool hearing how she went to auctioneering school, and they learn how to count really fast. They don't have to think about it. They count by twos and they count by fours, and it was super cool. So anyway, for those of you guys who saw us in our pretty clothes, and that's when my nails are all done. All right. Let's see. Erica, how long does it take for a newborn to learn to self-soothe? Excellent question. Okay, so typically it will take them about 3 months to get to the point where they can self-soothe. And when I say self-soothe, what I mean is, and you'll notice this on a newborn, to be able to get their hand to their mouth and keep it there. All right, where they can actually suck on their hands and they're not like flailing around. You know, you watch a newborn or a 1-month-old, and even if they get their hands to their mouth, they'll pull it away and they can't really keep it there, so they can't really soothe themselves. This is why swaddling with their hands up so their hands are close to their face is really great. It's why swaddling in general works really well with a baby that's less than 3 months old, because they need something to help them soothe themselves, because they can't really do it on their own. But by the time they're 3 months old is when they typically can take over and start to soothe themselves. If you're using any kind of a swaddler, it's the time to like really let them have their arm free at that point, so that they can get their hand to their mouth, so that they can soothe. You know, babies' brains are just not fully developed at birth. And so those first few weeks and months, you'll find that for many babies, they cry, they have what seems like colic, okay? What's happening is that baby is just unable, the brain is immature and not able to soothe. They're still sort of like fetuses at that point. And that fetus-like behavior to want to be constantly in motion, to want to be held tight all the time, to want to be sucking all the time. All those things are there, and that's what keeps your baby calm. And you'll need to be doing some of those techniques in order to help the baby out before they're able to soothe. And that's around 3 months. There's a really good episode that I did earlier. We were talking about how I used to do my live web TV show, and we're going back to that. It's the My Baby Expert show. So if you guys want to check out an episode called Calming Your Fussy Baby, that was a really good episode. I don't remember what number it was, but if you go to my, Joe's gonna send you the link right now. If you go to my video library index, scroll down or just click on the link here. But give them the whole index too, because they need to see. There's like 600 videos, okay, 600 clips from all. You've seen a ton of them. Great. Do you like them, Katie? Were they fun to watch? Because we spent a lot of time editing so that you guys would get that, just the content without all the prizes, without all the other stuff in the way, that you could get right to the content. But we're going to do more things like that coming up here on my page, where we have more guests, more topics. Yeah, I'm glad you like it. Topics, guests, and really some really fantastic things that we're going to go over. And maybe some of the old episodes, we'll redo them with some more current information as well. But yeah, there's one called Calming Your Fussy Baby. That's one to check out, Erica. Okay. Hearts for Erica. Hearts all around. More hearts. Yay. Yay. Okay. What time is it? Just getting started. Oh my God. Katie's saying, I used to watch you every week about 5 years ago. Crazy now that I have 3 kids. Katie, okay. All right. So you're one of the oldies here. I actually recognize your name now that you're saying that to me. Yeah, remember that 5 years ago? Can you believe that that long ago we were live streaming when no one was live streaming, okay? Back in like 2009, okay? 2009 was more than 5 years ago. It was like 6 or 7 years ago we started. It was crazy. Like right now, the fact that I could sit here with this little tripod and my cell phone, all right? Who would have ever even imagined this, that I could just turn this on and I could just go live the way we did? I used to have a bunch of people, Joe and Taylor, remember Taylor? And the computers all set up, and it was just like this whole complicated ordeal. That's how I met Jamie too. Jamie used to come over from the city. He'd take the train in, sleep on my couch, and do the show with me. And you could see some of the old episodes that we did together. It was really fun. But it helped you a lot with your first baby. It was I loved it, and I want to go back to doing some of those. So we're gonna do more. I'm so happy to see you here, Katie. Excellent. Yeah. You were live streaming before the cool kids. I actually was a pioneer of this live streaming Q&A stuff going on. Nobody was doing it. You know why? Because everybody kept asking me to host Twitter parties. And I'm like, are you kidding me? I used to do these Twitter parties. I'd be the expert. And you know me, like I just say a few words, you know? So how am I supposed to answer them in like 140 characters? And I'm typing these things and I'm like, this is crazy. Like I can't even keep up with it. And finally I just said to Joe, find a way for me to talk, right? That's how it came about. I was like, please find a way for me to be able to talk so I can go directly to them and just explain. And we figured it out, and it was great. Totally great. Yeah. So, So how many of you guys are going to be joining the group with me? How many of you guys are going to be going over and joining this private group later tonight, because we're going to be processing them? I'd love to see just some hands up for who's going to be joining with us. We're going to be doing some fun stuff over there. And we'll keep doing stuff over here too. We're going to be doing new stuff here. There's the link for Calming Your Fussy Baby. Now, don't forget tonight's prize, right? What's the prize tonight? It's the back buddy. One of my favorite. Oh my God, it is so comfortable. You know, I'm sitting here and I'm going, wow, this thing is really comfortable. Okay, you're already signed up. You're already signed up, Jennifer. Awesome. Excellent. Yeah, so someone's going to win the back buddy tonight. You need to love this post, and you need to comment here, which you did lots of comments tonight, so I'm sure everything's fine. And please share this with your friends too. You know, anybody that you know that's nursing, that's pregnant, that's planning on getting pregnant, share this information with them, okay? This is like one of the best things that you can do. Think about yourself, and you know, there's products, and then there's community, and there's education, and there's teachers, and there's someone who's going to make you feel like, wow, I feel so much more at ease. And isn't that everything when we first have our babies, when we're as new parents, whether it's our first baby, our second, or our fifth, we all need that little bit of reassurance. And so if you guys have felt reassured by the advice that you've gotten, and I know you have, because you've been sending me such beautiful messages. I love your messages. Your messages telling me that this is helping you, that these videos are helping, that our Q&As are invaluable, that it's helped you to stay with breastfeeding, it's helped you to breastfeed. Then do that, you know, share it with somebody, not for my sake, but for theirs. And we need a lot of love right now in the world, and we need to be supporting each other and spreading good information and good vibes and tons of love. The planet needs it right now. And so that's what we're going to do. Keep on doing what's good. Sharing is caring. Thank you, Joe. Yes, it is. Sharing is caring. Sharing is caring. I love that. I love him. I love him. Okay. So I think I am about done for tonight. Okay. Make sure that you enter for the back buddy, and make sure you join me over on the private group, and make sure you're getting notifications so that you see all of my live streams coming up. We're going to be doing some great stuff, and I don't want you to miss anything. Okay. So did everybody have a good time tonight? Thank you, Rosa. You're my blessing. Thank you.
You see Addie's comment?
What's Addie's comment? No, I didn't see.
I will be joining after I finish the class. I'm going to open my pump so I could sign up for the class.
Fantastic. Yay. Okay. Yep. Go tonight right after you finish the class. You just have to make sure that you, are signed up through one of the classes and it'll be fine, okay? And if you have any questions, you can just message us too, right there on our Facebook wall. All right. Love you guys. Have a good night and a great weekend. And I will see you all really soon. And I'll see you over in our little forum. Okay. Love you. Good night. Mwah. Bye.